The following segment is being sponsored by El Paso Health. So today we're visiting Dr. Andy Dominguez. He's a pediatric pulmonologist. How are you doing, doctor?
I'm good. Thank you for inviting me.
Thank you for being here today and allowing us to learn about asthma, pediatric asthma today. That's our topic today. I would like to begin with a question. What is asthma, doctor?
Well, asthma is childhood asthma is a chronic condition that is basically a persistent inflammation in the lower airway, meaning the bronchi, right? Okay. It is chronic. There's a lot of inflammation. It can be related to allergies, sometimes to viral infections, but it's something that is actually very common in childhood. Like 7.4% of our population, children, talking about children, will have a diagnosis of asthma.
Okay. And what can we do to help these patients, doctor? How do we get the diagnosis first? What signs can we look out as parents to be aware that our child has something?
So one of the things is very important to understand the diagnosis of asthma is a clinical diagnosis.
Okay.
There's a misunderstanding that you need to do certain pulmonary function tests to diagnose asthma. However, actually it's a clinical diagnosis, right? So we can diagnose very early in life. There's a lot of people think that you cannot do it until 5 years of age, but it's not. We can actually do it earlier than that. What are the most common symptoms of asthma? Well, the number one will be cough. We always have this thing in our minds that you see the movies, those kids that they have difficulty breathing and they have to run to the emergency department, grab the inhaler and all that. But the reality is cough. It can be just plain cough, dry cough, daily cough. Usually this cough will be mostly at nighttime, right? And throughout the night, this cough. Also, we will notice that this cough can be triggered by physical activity. They are doing fine and suddenly they start coughing. Excitement of their crying, they can also trigger that cough. And again, it's a dry cough, usually without any other type of symptom, right? Meaning no runny nose, no fever, etc. Well, it's a dry cough, persistent dry cough. One day you will be fine, some other days you have that cough, come and go, coming and going. The other symptoms that you can have something that we call wheezing. Wheezing is just basically a noisy breathing that is generated in the lower airways, and this is just secondary because you have the bronchi so tight that when the air goes in and out, you have a whistling sound. Most of the time, the physicians are the ones that are going to be aware about this symptom because you have to use your stethoscope to listen. But sometimes it can be so loud that sometimes the parents can notice the kid who's coughing and having some difficulty to breathe. They can hear that wheezing. And talking about difficulty breathing, so well, shortness of breath will be another important feature of asthma, right? That difficulty of breathing. Now, our patients with asthma, when they have exacerbation, sometimes also complain about chest tightness, difficulty to get the breath out. So that's very, very common also presentation for asthma.
Okay, so if I hear my son in the middle of the night presenting this wheezing, for example, and shortness of breath, what would you recommend?
First of all, you have to, if the patient is stable, let's say that he's not breathing too fast, it's just the wheezing and the cough, you can look to your doctor next day, right away, as soon as you can. If not, you have to go to the emergency department, right? It depends how you see it. How can I know if I go to an emergency department? Well, if he's breathing so fast that you know that he gets very tired, you notice that he cannot talk in full sentences. He's trying to talk and then he pauses and then he's gasping for air. That's no other choice. You have to go to emergency department. Now, let's say that your son or your daughter has difficulty to breathe, is coughing, but he can talk and complain and without any problem. Then probably you can talk to your doctor
or
go to
would you give him a cough medication?
Well, that's a good question. Actually, I will not give a cough
Okay.
medication. We have to understand that, especially if they're less than 4 years of age, there's no recommendation for cough syrups. It's
Okay.
contraindicated. They
Okay.
have more side effects than benefit.
Okay.
And even more than 4 years of age, there's the improvement is not much. And if it's asthma, it's not going to make any difference.
Okay.
So it is important to talk to your physician.
Okay. And how can we do as parents once our child has been diagnosed with asthma to help him out at home?
So one of the things, first of all, we have to follow recommendations of the physicians, right? Depending on the diagnosis of asthma, the severity. Let's say if it is just an intermittent asthma, which means it's just once in a blue moon you will have the
Okay.
asthma exacerbation, probably you have to carry your inhaler, your rescue inhaler, and have an asthma action plan that your physician is going to give to you, so you know what to do when anything happens. Now, if you have persistent asthma, then depend of how mild, moderate, or severe is your asthma, you will have certain treatment that it has to be daily. So you have to acknowledge that you have to use your daily control medication and then have available your rescue medication. That's number one. Number two, make sure that we avoid any type of respiratory illness as much as we can.
Okay.
If we know that somebody's going to visit us but they are sick, try to avoid that. Number three, we'll say, like, probably make sure that we wash our hands really very as much as we can, and let them, if they're well controlled, let them do sports. A lot of physical activity is very good. They can go do soccer, swimming, anything that they want, right? So that's a good recommendations that we can do for
And
them.
let the school know that they have asthma, right? That would be something important.
It's very important, and when the patient is diagnosed with asthma, the physician should give a form that is required actually by the school.
Okay.
So they acknowledge that this patient has asthma and they have the ability to give the medication in case of an emergency. So if your son has asthma, it is important to ask for that form to your primary care physician, so they in the school they acknowledge that he has asthma or she has asthma, and that they should have the medication with the nurse staff so they can give the medication in case of needed.
Okay, so I guess information is very important. How can we find out what our child is allergic to? What triggers their asthma?
Yeah, so
can we
I
do
think
that?
that's very important. Well, some of the asthma can be not really related to allergies, some of they do.
Okay.
So some patients, the asthma is going to be triggered by physical activity. It can be triggered by weather change. It can be triggered by some over exertion, right? So if you understand what is your trigger, is important because you can avoid them, right?
Okay.
Let's say it's your physical activity. Well, you have to take your control medication daily. Maybe you can use your rescue inhaler like 10, 15 minutes before physical activity, right? But let's say that you have an allergic component. So it is important to do an environmental allergy panel to see what I'm allergic to see if I can avoid. Like grass, you can be allergic to certain trees, bluegrass. It can be to dust mites. So there's many things that you can be allergic, right? So it depends what it is. Sometimes you can do something about it. Sometimes you cannot, because you cannot go outside and cut all the trees.
Of course.
So it
Just
depends.
imagine,
So
yeah.
it depends what you have, but you can do an allergy test for that.
Okay, and we were talking about dust mites and things that we can prevent.
So that might. So one of the tricky part is we'll say always to our parents. Let's say that you're complaining beside the cough, you have a little runny nose, probably watery eye, and you're thinking about allergies. So most of the time, if it's environmental, thinking about trees, pollen, and all that is seasonal. However, when you have allergy to those mites, most of the time it's going to be around the year. The reason why is because there's always those mites at home, and it's very difficult to.
So they're always going to be.
It's going to be there.
No matter what we do.
So there's things actually we can do. We can try to avoid all the stuffed animals that we have because they harvest a lot of those mites. The other thing is to avoid carpets. I know it can be difficult sometimes to remove them, but that will be another one. But one that it helps a lot is every once a week, you grab the linen of the bed, put it in a hot water in your washer machine, put it to dry, and then from there directly to the bed. That will give you more protection against dust mites. And the reality is that's the time when you're going to spend more time with the dust mites, when you're laying down in your bed, right? Because if you're walking around, you're not in your room, you're outside, probably you're not getting that exposure, but when you're at bed. So that's why it's very important to have this kind of changes in the linen weekly. Yeah.
Okay, so don't keep them stacked up in the closet. More than likely, whenever you get them out, they're going to be there.
That's correct. You will have there already. So that's why it's very important from the dryer to the bed directly.
Okay.
Because yes, you're right. If you haven't already stuck them there, they will have already dust mites.
Okay. So as a citizen that we are supposed to help people out, let's say I see a patient having an asthma attack, and I don't know this person, but I know there's something wrong. What can I do to help out?
So if you don't know this person, you don't know what, but you acknowledge that this is asthma, even if it's not, the first thing to do is just to call 911.
Okay.
Make sure that the patient is safe, he's in a safe environment, and you're safe also. But that's the thing that you have to do. On the other hand, if you're the parent of somebody with asthma, it's important to have your asthma action plan. That way, in that plan, you know what to do in case of an emergency, and to have always with you your rescue medication.
Okay.
And then voice out that you have asthma or that your son has asthma.
Yeah.
Please ask for help. Call 911. Those
Okay.
are the things that quickly we should be doing.
Okay, awesome. Well, thank you very much, doctor, for your time.
Thank you
We
for
hope to
inviting
see
me.
you very soon, talk about different subjects, and we will see you on our next segment.
Thank you so much.